So, just saw footage that the head of the CDC was testifying before Congress and basically saying, yeah, I could see how hospitals would be incentivized to mark things as COVID deaths when maybe they weren't.
We found that the governor of Colorado, who is a Democrat, actually did a research on this and found he had to get rid of 12% of the deaths that were recorded in state. Dr. Redfield, would you like to comment on that a little bit about the perverse incentive, and is there an effort to try and do something different in the way that these deaths are recorded so we actually have better records and better numbers, better data to go with?
Thank you, Congressman. I think you're correct in that we've seen this in other disease processes too. Early in the HIV epidemic, somebody may have a heart attack but also have HIV. The hospital would prefer the DRG for HIV because there's greater reimbursement.
And I know this is shocking to a lot of people. They say, oh, that can't possibly happen. They would never, inflate the numbers. This is a serious thing. And I know, not disagreeing with the seriousness of what's going on, but if you understand the medical system and you understand the insurance system, this should not be a surprise to you that things are getting coded as COVID deaths and being reported as COVID deaths when they actually aren't. This should not be a surprise to you, only because they incentivize recording these with more money, that Medicare will pay more money. So suddenly, wow, Medicare, the people who are 65 and older are dying more of COVID because the hospital can bill $39,000, $76,000. I don't know what the number is, but it's a lot more money that they can get. And so suddenly, oh, everybody who's dying is in their 70s and older. Well, that's interesting when that's everybody with Medicare, and suddenly a hospital can bill for a COVID death and make a lot more money. If you think this is new, if you think this is a new phenomenon that medical institutions are billing for codes that are more lucrative, a code basically being like a certain disease or cause of death, that they bill the insurance for that pays more money than other things. If you don't think that this has been going on for decades, you are in denial. I mean, this is one of the major problems of our healthcare system, is that you can bill for all these ludicrous things that don't even help people, and the insurance companies will just pay because, essentially they're getting duped. And insurance fraud is happening all the time. This is why I do not deal with any insurance, because it is an absolute disaster, okay? And we see with things like meniscus, your knee meniscus surgery is been shown in studies to be no more effective than a placebo. Yet this surgery gets done all of the time. Where's the outrage? Where's the outrage from people getting these ineffective surgeries? It's nowhere, right? That you can basically, bill for things like, if someone has heart disease and they have a heart attack, you can put them on a whole food plant-based diet and they can reverse the disease. Or you can do coronary artery surgery, a single, double, triple, quadruple, quintuple bypass, bill their insurance for 100 grand, 150 grand, 200 grand, and make your money, and no one bats an eye. This stuff has been going on all the time. So if you're going to incentivize a hospital to get paid more money when they say that their patient died of COVID, guess what? A lot more patients are going to show up dying of COVID. That's just how the system works. That's what we got. That's why we need healthcare reform. We all know this. This should be common sense to you guys. This should be self-evident. And so if this is the system where Medicare is going to pay more money for something else, then guess what? They're going to get a lot of bills for that something else, no matter what the heck it is. All right, guys, signing off. I'll catch you next time. I have a special gift for you. The Autoimmune Recovery Blueprint is everything I wish I had 10 years ago when I came down with an autoimmune disease and doctors couldn't help me. Condense it down into a 12-page ebook, yours free when you sign up for my email list.